Eating disorders do not discriminate. Any one of us can develop an eating disorder. We are no different. Eating disorder and trauma therapist Ashley McCann. Mother Christine Harris notes how she would tell people, I just think it's a disease of privilege, referring to eating disorders. However, this all changed when her son developed one while they were living in financially unstable conditions. Since her son's suffering, she acknowledges the fact that her family's food instability absolutely contributed to the triggering of her child's eating disorder, 100%. Unfortunately, this is not a unique experience. The stigma of eating disorders being an issue of willpower and a privilege of choosing not to eat is prevalent in society. Among society, there is a stereotype that eating disorders are most prevalent for people with a high socioeconomic status, especially anorexia, claiming that it is a disease of affluence. However, research disproves this claim. In fact, eating disorders are more likely to occur in ethnic minority groups, such as African Americans, which are also the groups that statistically have more people in poverty. Additionally, access to eating disorder treatment is difficult to obtain because of how few insurance companies include it in their coverage, especially for low-income individuals' insurance, if they have it. As a society, more awareness around the complex causes and consequences of eating disorders is needed to enhance access to recovery resources for heavily affected, low socioeconomic status and minority communities. The cause of eating disorders cannot be pinpointed to one specific thing. There is a common misconception that eating disorders are a choice made by the person with one to change the way their body looks. This misunderstanding is even more common around anorexia nervosa, a type of eating disorder characterized by a low body weight for the patient's own medical history due to heavy restriction of food intake. The two other most common types of eating disorders are bulimia nervosa, characterized by shame-filled binge eating that is followed by a form of purging, and binge eating disorder, characterized by periods of intense overeating that is followed by heavy restriction. Both are hard eating cycles to break that cause a large amount of internal shame. Although eating disorders and disordered eating as a whole can take many different forms, eating disorders are actually often a cover or coping mechanism for deeper issues occurring. McCann notes how people suffering from eating disorders are often actually looking for a sense of belonging, of connection, of love, feeling worthy or valuable, of feeling safe or secure. But this is covered by what society perceives to be vanity. A few commonly noted risk factors for eating disorders include family history and genetics, other mental health issues, a history of dieting, and environmental factors. These listed different types of eating disorders and risks prove that there is no direct correlation between income and having an eating disorder. While there is no direct cause for all eating disorders, oftentimes experiencing a traumatic event can be a trigger for an eating disorder. McCann notes that this occurs as trauma can really prime us to adopt all kinds of maladaptive habits. Stress from the event can leave the person feeling hopeless and powerless, to where it feels as though their body and food is the one of the very few things left that they can control. Many impoverished people experience chronic stress, discrimination, trauma, and food insecurity, which is proven to be linked to an increased risk for an eating disorder. McCann also notes how people can use them, eating disorders, to numb and alleviate stress. Just like trauma has higher correlation with lower socioeconomic status, so does food insecurity. Data from the National Eating Disorders Association shows the odds of adults having binge eating if they experience food insecurity are 1.66 times the odds of adults having binge eating if they have food security. The research article Disease of Affluence, a systematic review of the literature on socioeconomic diversity in eating disorders by Herc et al., came to a similar conclusion. Low food security was associated with bulimia nervosa as compared to those with a healthy weight and no eating disorder. Food security did not differ significantly between bulimia nervosa and binge eating disorder. Together, trauma and food insecurity, which are higher for people of lower socioeconomic status and minority groups, lead to increased likelihood for the development of eating disorders, especially bulimia nervosa and binge eating disorder. Similar to the complexity of the causes of eating disorders, the effects also intertwine and branch into multiple different facets of life. While much of society does not think beyond improper nutrition and body changes as effects of eating disorders, there is much more to it. No matter the type of eating disorder, the effects branch into every aspect of the sufferer's life. Typically, all they can think about is food, what they will eat, when they will eat it, and if they should or shouldn't eat it. It is an all-consuming disease. It can be a debilitating disease that causes isolation from others and overall discontent with life. If their friends and or family have not personally experienced an eating disorder, it can be extremely hard to understand why the person is pushing everyone away and cannot simply eat the food that is needed for survival. This lack of understanding can contribute to the stigma that swirls around eating disorders being rooted in vanity. However, when you look at the statistics, it is clear that this is a cutthroat mental illness that is not reserved for people of affluence. For all three main types of eating disorders, there are additional mental illness complications with depression, suicidal thoughts or actions, anxiety, and substance abuse. For anorexia and bulimia, personality disorders such as bipolar disorder may also occur. Additionally, anorexia is heavily intertwined with obsessive compulsive disorders. It is clear that eating disorders run deeper physically and mentally than stress over food and how their body looks, contributing to the argument that eating disorders are not a choice to be made by people of affluence. With the complex causes and consequences of eating disorders, it may be difficult to know how to approach recovery. For someone who has not been educated on or had proper exposure to the topic of eating disorders, it is very difficult to know how to approach the healing process. Since eating disorders often go unnoticed, carry little importance to society, and are seen as illnesses of affluence, having access to professional help has become a luxury. Depending on the type of eating disorder, there are multiple different paths for recovery, but professional help is optimal for a full recovery. Professional help can be inpatient care or outpatient care. Either way, a team of professionals is needed for the maximum amount of recovery possible. The team often includes a medical doctor, a psychiatrist and or a therapist, and a dietitian where they look at all the special needs for the patient with everything from lab reports to trauma history. Ideally, all of these professionals would be ones that specialize in eating disorder recovery care, since they are such individually unique diseases that are widely misunderstood by society. All of these professionals and eating disorder experts come at a cost, a very high cost, often unaffordable cost for people with financial instability. Additionally, these resources are typically only available in high-income urban areas, which adds another barrier for access to recovery resources. Statistics from the National Eating Disorders Association shows that over the past few decades, eating disorder rates have increased by more than 120%, affecting more women than men and more ethnic minority groups than their white counterparts. Behind opiate addiction and ahead of depression, eating disorders are the second most deadly psychological illness. To put it into perspective, a life is lost every 52 minutes as a direct cause of an eating disorder. Moving forward, more accurate information like this from credible sources, not social media, about eating disorders in the media and education on eating disorders in homes and schools needs to take place. Since it is such a deadly disease that is most common among teenagers, it deserves more attention from doctors, parents, and educators. Since these are figures of importance and authority to adolescents and teenagers, they may be more receptive to the information when it comes from them. The education of parents, The education of parents, educators, teenagers, and the general public is vital for early intervention and thus a quicker, easier, and cheaper recovery. If the friend or family member of someone struggling with an eating disorder does not understand the disease, McCon advises them to ask their friend or family member suffering questions to try to understand it from their perspective. This has proven to help with recovery rates. Traditionally, Additionally, McCon notes how society as a whole does not have a healthy relationship with food, as seen in social media, diet culture, and the labeling of foods as morally good versus bad. While this all contributes to the increase in global eating disorder rates, low income and minority groups are heavily impacted by the inaccurate stigma surrounding eating disorders, since this directly correlates with the level of difficulty of receiving treatment. Eating disorders are a deadly and spreading disease, and they do not discriminate on who their victim is.